This video is about understanding your bladder and how it works and what problems can occur. My name is Paul Abrams and I'm a urologist at the Bristol Urological Institute, and for many years I've specialised in waterworks problems. First, I think we should think about how things work normally. As you can see, we have two kidneys that produce urine, one on the right and one on the left. They're protected from harm's way by being tucked up under our ribs at the back, just below the chest. There are two thin tubes called the ureters which carry the urine down from the kidneys to our bladder. The bladder is also protected, this time behind the bone, the pubic bone, that you can feel at the bottom of your tummy in the middle. When we pee, the urine then passes through a tube that goes from the bladder to the outside. This is called the urethra. The urethra comes out at the tip of the penis in men, or from an opening just in the front of the vagina in women. We have kidneys for two main reasons. First, to purify the blood so that we can get rid of waste products like too much salt from the body. And secondly, to make sure we have the right amount of water in our body. That's so that we don't either get dehydrated or get waterlogged. So the bladder gradually fills up both by day and by night. And the bladder stores the urine until we're ready to pee. Some people say ready to pass water. The urine is kept in the body by this special muscle, the sphincter muscle at the exit of the bladder. And this acts like a tap, which during bladder filling is closed to stop us leaking. The sphincter muscle stays closed until we are ready to pee. We usually go to pee when our bladder starts to feel full, or if we want to empty our bladder at other times, such as just before we go to bed or before a long coach trip. When we're ready to pee, our brain sends down signals to open the tap, the sphincter muscle, and to make sure that our bladder contracts to squeeze the urine out. The bladder continues to squeeze, that is to contract, until the bladder is empty. Then the tap closes and the bladder relaxes until we're next ready to pee. Our kidneys make about 1,500 millilitres or 3 pints of urine every 24 hours. Most bladders hold about 300 ml, so that means we need to go about 5 times every 24 hours. Of course, if we drink more, we have to go more often. We also have to go more often if we eat a lot of water-containing food like fruit, salads, vegetables, rice or pasta. You will notice then that you go more often. Next, we need to talk about red flags. In other words, things that might indicate that something more serious may be wrong. First, if you ever pass blood in your urine, you must go to see your doctor immediately. It could indicate that you have a cancer somewhere in your waterworks. Secondly, if you have pain when you pass your water, this may indicate you have an infection. Now, these are usually easily treated by antibiotics, but you should certainly have a urine test first. The common things that can go wrong are that you may lose control of your bladder and leak urine into your clothes, or fear that you're going to wet yourself. You may, on the other hand, start to get up at night to pass urine, and this can be very irritating. And older men can have problems with their prostate. So these are the 4 common conditions that we see more often, particularly in older people. Having leakage problems because you're unable to control your waterworks is usually very upsetting, as it can be extremely embarrassing. And there are 2 main types of leakage. First, there is a leakage that occurs when you're physically active, running, jumping, etc., or when you cough and sneeze. This is called stress incontinence. It doesn't mean stress in the sense of mental or anxiety problems. It means additional pressure on your bladder that is the cause for the leakage. Stress incontinence is mainly suffered by women who've had children. The reason for this is that when the baby comes through the birth canal during the process of labour, the tissues in the vaginal area get stretched. If the muscles in the vaginal area and other tissues don't recover well, then the muscle that controls the exit of bladder, the sphincter muscle, can't hold the urine in when the pressure on the bladder increases, as I've said, for example, when you run or jump, when you cough or sneeze. If you have stress incontinence, what can you do about it? Well, firstly, be as slim and fit as possible. If you're slim, then the pressure inside your tummy is less, so there's less pressure on your bladder. It's been shown that weight loss improves the type of leakage. Second, do your pelvic muscle exercises, as these are the muscles that guard the exit of the bladder. We've made a video of pelvic muscle exercises which you can watch. In the animation you can see how the bladder sits on top of the pelvic floor muscles, and the pelvic floor muscles support the neck of the bladder and the urethra. After childbirth, these may give less support, and strengthening them can help prevent leakage. You can see how tightening the muscles supports and helps close the exit of the bladder. However, like any other muscle exercise, for example, building up your shoulders or your biceps, it takes time, and you need to do the exercises routinely on a daily basis for about 3 months before you see a major improvement. However, before you start the exercise, you need to be sure that you can tighten the pelvic floor muscles, otherwise the exercises are a waste of time. Now you can check whether you can tighten these muscles by seeing if you can stop the flow of urine in midstream. You can also check, if you want to, by putting a finger into the vagina and then tightening the muscles on your finger. The muscle is the same one that you would use to prevent yourself from losing gas from your back passage, in other words, from farting. If you're not sure whether you can contract the pelvic floor muscle, then you need to get your doctor to arrange for you to see a nurse or physiotherapist who can teach you. If losing weight and doing the exercises have improved you enough, then keep up the good work, and you don't need to have any further treatment. However, if the improvement is not sufficient and your quality of life is still suffering, then your doctor will arrange for you to see a surgeon to consider an operation, which normally can cure or certainly much improve your leakage. Now, the second type of leakage that is common is urgency incontinence, and this is the type of leakage that occurs because you get less warning than usual of when you need to go. So after the signal that you need to go, you find that you have to rush, and sometimes you may not get there in time and you may leak. This is part of a condition called the overactive bladder, OAB for short. And this is the main cause of urgency and urgency incontinence. Now, OAB is very common and occurs in 1 in 10 of all people, but does tend to become more common as we get older. So you get this sense of, I've got to go now or I may leak, and you rush to the bathroom. And that's what we mean by urgency, hence the name urgency and urgency incontinence. It also tends to mean that you will go more often during the day and have to get up at night. And really what has happened is that you've lost some of your ability to stop the bladder from contracting, so that it contracts when it wants to rather than when you want it to. And usually there's no obvious cause in most people. There are some groups of people who have a condition such as a stroke, or they suffer from Parkinson's or MS. They get it more commonly. And as I've already said, we will all get it eventually if we grow old enough, but certainly it becomes more common after you're about 60 or 70. So if you have overactive bladder, what can you do about it? Well, it's helpful to do the same things that we talked about for stress incontinence. So that's losing weight, getting generally fit, and doing pelvic floor muscle exercises. However, there are some additional things that you can do. Some things that we eat and drink make the overactive bladder worse, and caffeine-containing liquids and foods are the best known. That's rather sad because they're the things we often like, such as coffee, tea, including green tea, and chocolate and cocoa, and in addition in fizzy drinks. So it's worth stopping or reducing these, and this then helps most people with their symptoms. It's also worth thinking about how much you drink, and making a bladder diary is very useful. As you can see from this diary, you need to write down the times you pee and how much you pee. In order to measure it, buy a plastic measuring jug and record it in millilitres, so we have a volume for each time you pass urine. Then you can add up the amounts you pass for each 24-hour period, and if it's more than 1500 mLs, consider drinking less. Also, please write down every drink with what it was, tea or coffee, etc., and the amount you drank. It's also helpful for you and your doctor if you mark any leaks that you might get, and each time you need to change your pad or change clothing because of a leak and they are wet. You can keep the bladder diary from time to time to see how your treatment is going. You can also try something called bladder training. First, you keep a bladder diary to see how long you can reliably control your bladder without a leak. So, for example, if the diary shows that you're always okay for 1 hour after you've peed, then start off by emptying your bladder every 60 minutes, 1 hour, whether or not you want to go or not. If after a couple of days you can do this reliably, then increase the intervals by 15 minutes, so that's up to 75 minutes. And increase it every few days as long as you are able to control the urine for these increasing times. So keep going until you can hold your urine for at least 2 or 3 hours. The idea behind this is that your brain learns how to regain control over your bladder. But if you still have problems after you've done all these things, then arrange to see your doctor and tell them that you've been doing these various things and show them your bladder diary. The doctor may then decide to treat you with some tablets that are designed to make the bladder relax. These tablets usually help, but unfortunately they rarely cure the overactive bladder, but in many people they make it sufficiently better. If you still have problems after the tablets, then your doctor will probably send you to the hospital to discuss possible procedures that may help you. Now, the other problem that's difficult in many people is having to get up at night to pass urine. And of course, this can be very bothersome because you lose sleep. As we get older, more and more of us have to get up at least once. So by the time you're over 70, more than half of all people have to get up once, and about 1 in 3 of all people get up 2 or more times. And there's lots of reasons why this might happen. When we're young, we have a hormone that we produce that cuts down urine production at night to only about 1/5 of what we pass in 24 hours. But by the time we're 65, we will be passing about 1/3, and this is why people have to get up at night. But some men and women produce a lot more than 1/3, and of course this means they have to get up 2, 3 or 4 times and greatly disturbs their sleep. And if you have to get up at night and it's a problem for you, what can you do about it? Well, first of all, keep a bladder diary for 2 or 3 days, that is 24-hour periods, so you know how much and when you pass urine both during the day and during the night. You also know how much you're drinking and what you're drinking. When you go to bed, empty your bladder and write down the time you went to bed as well as the volume. Every time you have to get out of bed to empty your bladder, again, write down the time and the amount you passed. And then when you get up in the morning, empty your bladder as soon as possible and write down the time you got up and the amount that was in your bladder. That urine in the first passing of urine in the morning, that urine has been produced by your kidneys while you're asleep. Now, what the diary might show is that you're drinking too much in the evening. So, for example, if you go to the pub, as we've said, and have 3 or 4 pints, then you will expect to get up at night. But it can also be due to things like eating a lot of water-containing foods in the evening. So try reducing your liquid and water-containing food intake in the evenings to see if that makes a difference. If you're good at arithmetic, you can add up the numbers and you may see that you're producing more than 1/3 of your urine at night. If you are, then this is called nocturnal polyuria. Nocturnal, of course, means nighttime. Polyuria means too much urine. So you're producing too much urine at night, and that's the reason you're having to get up more often. And this is what is shown in the bladder diary example you're looking at the moment. If you're quite fit, then you can try increasing your exercise, particularly later in the day. What tends to happen as we get older is that water can accumulate in your legs because we're sitting around, and the walking helps you to clear this. So if you have a problem, take your bladder diary and show your doctor. And there is a red flag here. If you have a heart condition, then passing too much urine at night can be due to that. So if in doubt, take your bladder diary and show it to your GP and ask, is my heart the cause of the problem? Finally, let's talk about waterworks problems that might be due to the prostate. Now again, there are a couple of red flags that we need to think about and would mean that you would go and see your doctor straight away. So, if you'd noticed that you'd started to leak urine during the night when you're asleep, well, firstly, you might be very embarrassed about this, but this should not happen. Secondly, you might notice that your lower tummy is getting bigger, and that can mean you're not emptying your bladder properly. Both these symptoms could be indicative of a serious condition. So, as I've said, go and see your GP. As you know, only men have a prostate, and as you can see in the diagram, this sits at the neck of the bladder. Often it causes no problems, and any symptoms that you get in your waterworks could be due to something else. However, as men get older, the prostate does tend to get bigger. This may still not matter, and it's only when the prostate narrows the exit of the bladder, as it does in the right-hand diagram, that it's called benign prostatic obstruction. Benign means that it's not a cancer, and the obstruction means that the bladder muscle has to work harder to push the urine through the narrowed urethra, and this can lead to a slow stream and sometimes leads to the bladder not emptying fully. However, symptoms that older men get are often due to other conditions. For example, we've already talked about the overactive bladder. We've already talked about nocturnal polyuria, having to get up too much at night. So these symptoms can be thought to be due to the prostate when they're not. So what can you do about it? Well, all the simple things we've already talked about, watching what you eat and drink to avoid getting up, and the other simple things like getting fit. However, if your problems are due to prostate obstruction, there isn't much you can actually do about it. However, you can provide your doctor with very useful information. And certainly if your symptoms remain bothersome, then go and see your doctor. Remember, once again, take the doctor your bladder diary completed for 3 days. You can also provide measurement of the speed at which you pass urine, and this is very useful information, and it's very easy to do. All you need is a stopwatch or the second hand on your own wristwatch and your measuring jug. When you're ready to start peeing, as soon as the flow starts, press the stopwatch or look at your second hand and empty your bladder. You then know how long it's taken you to pass that amount of urine which you have measured. Now you can tell your doctor your average flow rate, which is the amount of urine you passed, for example 200 ml in 40 seconds means 5 ml per second. That's your average flow rate. It's best to do several measurements on different occasions. Now, if you find that the average flow is more than 10 ml per second, it's very unlikely that you have prostate obstruction, and it's likely that it'll be a condition like overactive bladder that's the problem. However, if your doctor thinks the problem is your prostate, then there are a couple of types of tablets that they can try which may help you. If these aren't successful, then you will probably be referred to the hospital to see a surgeon like me to see whether or not a prostate operation would improve you. So we hope that this video has helped you to understand how your bladder works normally and what might go wrong with your waterworks if you get one of these common conditions, the two types of leakage, stress incontinence and urgency incontinence, having to get up too much at night, or possibly have prostate problems as an older person. So please consult your doctor if you are at all concerned, and don't ignore the red flags that we've talked about. Remember, prevention is better than cure, so please keep fit, keep slim, and keep safe.